Welcome to today's video about early signs of brain tumor. Did you know that over 308,000 people worldwide are diagnosed with brain tumors every year? That's one person every 2 minutes. What's even more shocking? Many of these cases start with subtle, almost unnoticeable symptoms that most of us ignore every day. Headaches that don't go away, changes in vision, or even unexplained fatigue. These might seem like small issues, right? But could they actually be early warning signs of something far more serious? Here's the big question. Are you missing the signs your body might be trying to tell you? In this video, we're uncovering the 11 early signs of a brain tumor that science has proven time and time again to be critical for early detection. And here's the best part. Knowing these signs could save lives. Not just for yourself, but for someone you love. Stay with me until the end, and I'll share the one surprising symptom that could be the most important of them all. This isn't just about fear. It's about awareness, empowerment, and hope. Let's dive in. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. All right, let's dive straight into the list of early signs of a brain tumor, starting with the first one. Persistent headaches. Headaches are a common symptom that most people experience occasionally, but when they become persistent and different from your usual pattern, it's worth paying attention. These headaches can signal increased pressure in the skull, often caused by a tumor pressing on surrounding tissues or blocking the normal flow of cerebrospinal fluid. This buildup leads to a condition called intracranial hypertension, which is what triggers the pain. A significant clue lies in how the headaches behave. They are often worse in the early morning because lying down during sleep increases brain pressure. You might also notice they don't respond well to regular painkillers and may come with other symptoms like nausea or vision changes. A study published in the Family Practice in 2015 highlights that 56% of patients with brain tumors reported progressive headaches as an early sign. These headaches are frequently described as dull, deep, and persistent, often radiating from a specific part of the head depending on the tumor's location. If you've been noticing such changes, it's not something to dismiss. Being aware of your body and discussing unusual symptoms with your doctor could lead to earlier detection and better outcomes. Early diagnosis makes a difference. Next, number 2. Nausea and vomiting. Nausea and vomiting can sometimes be signs of something more serious happening in the brain. When a brain tumor grows, it can increase pressure inside the skull. This is known as intracranial pressure. As this pressure builds, it can trigger areas in the brain that control nausea and vomiting, especially the medulla oblongata. This happens even without any issues in the stomach or digestive system. A recent study published in Clinical and Translational Neuroscience in 2020 highlighted that about 20% of patients with brain tumors reported unexplained nausea or vomiting as one of their early symptoms. What makes this even more significant is that these symptoms often occur in the morning, when intracranial pressure tends to peak after lying down all night. This pattern can set it apart from nausea caused by other conditions, like a stomach bug or food poisoning. Sometimes, vomiting might even bring temporary relief because it reduces pressure momentarily. However, if nausea and vomiting don't seem to have a clear cause and persist over time, it's worth taking seriously. Paired with other symptoms like headaches or vision changes, it could point to a need for further medical investigation. Always listen to your body when something feels off. Next, number 3. Seizures. Changes in brain activity are a common cause of seizures. When a tumor grows in or near areas of the brain responsible for electrical signaling, it can disrupt the normal flow of these signals. This disruption often triggers sudden and uncontrolled electrical bursts in the brain, leading to seizures. These episodes can range from mild twitching in a limb to full-body convulsions, even in individuals with no history of epilepsy. Research has shown that about 30 to 50% of individuals with brain tumors experience seizures as an initial symptom. A study published in the journal Oncologist, 2014, highlighted that tumors in the frontal or temporal lobes are more likely to cause this symptom. These areas regulate motor function and sensory processing, making them vulnerable to abnormal activity when a tumor develops. The type of seizure can sometimes hint at the tumor's location. For example, focal seizures, which affect one area of the body, might suggest a tumor in a specific part of the brain. Early detection is critical. If someone suddenly experiences seizures, especially without a known cause, seeking medical evaluation promptly is vital. This can lead to quicker identification of potential underlying conditions, including brain tumors. Next, number 4. Vision changes. When it comes to brain tumors, changes in vision are a serious red flag. A tumor pressing on the optic nerve, located near the brain's visual centers, can disrupt normal sight. Symptoms might include blurred vision, double vision, or even partial loss of eyesight. These issues often develop gradually, making them easy to overlook, but they can also come on suddenly in some cases. A research in the journal Clinical Anatomy of the Cranial Nerves, 2014, highlights how visual field defects, specifically peripheral vision loss, are among the earliest symptoms in patients with tumors near the optic chiasm. This study found that 60% of patients with pituitary tumors experienced such visual disturbances before receiving a diagnosis. This happens because the tumor compresses the optic pathways, affecting how the brain processes what you see. If you notice unexplained visual changes like difficulty reading, distinguishing colors, or seeing in dim light, it's essential to get checked. These problems might not just be about your eyes, they could signal something more. Early detection of vision changes linked to a brain tumor can improve treatment outcomes and even save your sight. Always trust your body when it's giving you a warning sign. Next, number 5. Difficulty speaking or understanding speech. Speech difficulties, like slurred words or trouble finding the right phrase, can be a subtle yet important warning sign of a brain tumor. Tumors in specific regions, such as the frontal or temporal lobes, can disrupt how the brain processes language. The left hemisphere, especially areas like Broca's and Wernicke's regions, plays a crucial role in speech production and comprehension. When a tumor puts pressure on or invades these areas, it can cause noticeable changes in communication. Research published in Neuropsychological Rehabilitation, 2023, highlighted that speech deficits are among the most common early symptoms of gliomas, particularly low-grade ones. The study found that patients with left hemisphere tumors reported some form of language impairment even before diagnosis. This can range from mild word-finding issues to severe inability to form coherent sentences. These changes often develop gradually, making them easy to overlook until they interfere with daily life. Real-world examples include struggling to complete sentences, substituting incorrect words, or misunderstanding simple instructions. If you notice these symptoms, especially alongside others like memory problems or headaches, it's worth seeking medical advice. Early recognition of speech difficulties can be key to catching brain tumors in their initial stages. Next, number 6. Weakness or numbness. A brain tumor can disrupt the normal functioning of the brain in many ways, one of which is by affecting motor control and sensation. When a tumor grows near areas responsible for movement, such as the motor cortex, or presses on nerves that transmit signals, it can lead to weakness or numbness in specific parts of the body. For instance, you might feel one side of your body becoming weaker, or find it harder to grip objects or walk steadily. This isn't just random, it's a sign that the tumor is interfering with neural pathways. Recent studies have highlighted how specific types of brain tumors, like gliomas, are more likely to cause such symptoms. A 2016 article published in the journal Neuro-Oncology noted that nearly 55% of patients with gliomas experience localized weakness as their first symptom. This weakness can range from subtle, like difficulty lifting a coffee mug, to severe, such as struggling to climb stairs. The same applies to numbness. A tumor affecting sensory pathways can block messages traveling from your body to the brain. As a result, you might lose sensation in a hand, foot, or even half of your face. These signs shouldn't be ignored. If they persist or worsen, consulting a doctor is essential for further testing. Next, number 7. Changes in personality or behavior. Personality changes can sometimes be the first clue that something isn't right in the brain. Tumors located in the frontal lobe, the area responsible for decision-making, emotional control, and social behavior, can disrupt how people react to situations. This may show up as increased irritability, loss of inhibition, or even apathy, where someone seems less interested in things they used to care about. These shifts aren't always dramatic. Subtle changes like becoming more forgetful or withdrawn can also occur. A 2024 study published in Curious highlighted how frontal lobe tumors often lead to emotional instability. Researchers found that nearly 60% of patients with such tumors experienced significant mood changes, including anxiety or depression, as a primary symptom. This is because tumors in this region interfere with the brain's ability to regulate emotions and process social cues, making individuals more prone to unpredictable or inappropriate reactions. Imagine someone who was always calm suddenly acting impulsive or uncharacteristically aggressive. These changes can be distressing for both the person and their loved ones. It's crucial to pay attention to these red flags and seek medical evaluation, as early detection can make a big difference in treatment outcomes. Next, number 8. Memory problems. Changes in memory can often be one of the earliest clues pointing to a brain tumor. This happens because specific areas of the brain, like the hippocampus and temporal lobes, are responsible for processing and storing memories. When a tumor grows in these regions, it can disrupt normal functioning, leading to issues like forgetting recent events, difficulty retaining new information, or feeling mentally foggy. A recent study published in the journal Neuro-Oncology 2022 highlighted that nearly 30% of patients with brain tumors reported memory impairment as one of their initial symptoms. These changes are often subtle at first, such as forgetting appointments or struggling to recall familiar names, but they can progress as the tumor grows. Pressure on surrounding brain tissue caused by the tumor, along with swelling, can also interfere with the communication between neurons. For example, gliomas or metastatic tumors in the frontal or temporal lobes are particularly known for causing noticeable memory problems. This isn't just limited to short-term memory. Long-term memory can also be affected depending on the tumor's location. If you notice persistent forgetfulness or unexplained memory lapses, it's important not to ignore them. While they could have other causes, such as stress or aging, they may also be an early warning sign of something more serious. Next, number 9. Hearing loss or tinnitus. A tumor growing near the auditory nerve or brain regions involved in hearing can disrupt how sound signals are processed. This can lead to hearing loss in one ear, persistent ringing, tinnitus, or both. These symptoms often occur when a tumor presses on the 8th cranial nerve, which carries sound and balance information from the inner ear to the brain. One common example is an acoustic neuroma, a non-cancerous tumor that grows on this nerve. Studies have highlighted that tumors affecting this nerve often result in gradual, rather than sudden, hearing loss. Research published in Frontiers in Neurology, 2022, found that over 70% of patients with acoustic neuromas experienced asymmetric hearing loss before diagnosis. Tinnitus, on the other hand, can present as a high-pitched ringing or a constant humming sound that doesn't go away, even in silence. One key reason for these symptoms is that tumors interfere with blood flow and nerve signaling in the auditory pathway. If left unchecked, the tumor can grow and further damage surrounding structures. Early detection matters. Hearing tests, alongside imaging techniques like MRI, help identify these changes early. This can lead to prompt intervention, improving outcomes and preserving hearing where possible. Next, number 10. Difficulty. Swallowing. Swallowing is a complex process controlled by a network of nerves and brain regions. When a brain tumor grows in certain areas, like the brainstem or near cranial nerves, it can disrupt this coordination. This often results in dysphagia, the medical term for difficulty swallowing. It may start subtly, perhaps with choking on liquids or food getting stuck in the throat, and gradually worsen. Recent research highlights the significance of such symptoms. A 2024 study published in BMC Cancer found that 15% of patients with posterior fossa brain tumors, particularly those affecting the brainstem, reported dysphagia as one of their first symptoms. The study emphasized how tumors in this area can compress or irritate cranial nerves 9 and 10, which play a key role in swallowing. Ignoring swallowing problems might delay diagnosis. If someone experiences this along with other symptoms like unsteady balance or slurred speech, it's worth seeking medical attention. Early recognition can make a significant difference. While swallowing issues are common in many conditions, they deserve careful consideration when linked with neurological changes. Next, number 11. Changes in taste or smell. Tumors in the brain can disrupt critical sensory pathways, including those responsible for taste and smell. The olfactory bulb and related neural structures process smell, while the gustatory system governs taste. If a tumor develops near the frontal lobe, temporal lobe, or olfactory nerve, it can compress or irritate these regions, leading to noticeable changes. Smell distortion might present as anosmia, loss of smell, phantom odors, smelling things that aren't there, or altered scent perception. This could mean everyday smells, like coffee or flowers, suddenly become unpleasant or unrecognizable. Similarly, taste changes may include difficulty distinguishing flavors or the sudden onset of metallic or bitter tastes. These issues may seem minor, but can be significant red flags when paired with other neurological symptoms. A 2022 study published in the journal Cancer Treatment Reviews highlighted that patients with tumors near the olfactory bulb reported early smell-related symptoms. These disruptions often precede other signs, making them important for early detection. If someone notices such changes persistently, it's crucial to seek medical advice. Early intervention can improve outcomes significantly. Recognizing how the brain's sensory pathways respond to pressure or growth helps us better understand the nuanced signs of brain tumors. Next, number 12. Hormonal imbalances. Brain tumors located near the pituitary gland or hypothalamus can disrupt hormone regulation in the body. These areas control vital processes like growth, metabolism, and reproduction. When a tumor presses on or invades these structures, it may cause hormonal imbalances that manifest as early warning signs. For instance, prolactinomas, tumors that affect the pituitary gland, can lead to excess prolactin production. This might result in missed periods, unexpected breast milk production, or sexual dysfunction. Other types of pituitary tumors may cause cortisol overproduction, triggering weight gain, high blood pressure, or even a rounded face, known as Cushing's syndrome. A recent study published in the Journal of Clinical Endocrinology and Metabolism, 2018, highlighted the role of small pituitary tumors in subtle hormonal changes that often go unnoticed for years. The research emphasized that even minor shifts in hormones, like thyroid-stimulating hormone, can create symptoms such as fatigue, depression, or sudden weight changes. These signs might seem unrelated, but could point to a growing tumor. Pay attention to unexplained symptoms like these, especially if they persist or worsen. Hormonal shifts are not always obvious, but can be critical clues. Early detection can make a big difference in treatment outcomes. Always consult a doctor if something feels off. So, now we know, while some factors contributing to brain tumors are out of our control, like genetics, others, like lifestyle and environmental exposure, give us the power to make informed choices. Knowledge is your greatest defense. If you found this video helpful, share it with someone who might need this information. Awareness can save lives. And don't forget to hit that like button, subscribe, and turn on notifications so you won't miss more videos like this. Take care of your health, listen to your body, and stay curious. Your brain will thank you. See you in the next video.